All right, let's kick things off with the big one. This is the question that really drives so much of what we do, from the materials we buy to the courses we take. We all ask this, right? We're constantly searching for that one best composite, thinking that the brand is the magic bullet for longevity. But, the evidence is starting to tell a different story. The materials today are all incredibly good, so maybe the secret to success is somewhere else. Let's see what the research actually shows. This isn't some small, perfectly controlled university study. This is in practices just like yours. 34%. Just let that sink in for a second. That's the percentage of composite restorations that make it to 15 years without anyone having to go back in and do something to them. This number comes from a gigantic UK dataset that looked at over 3.5 million restorations. So we know a whole lot of these restorations are failing over time. But what's actually causing it? What are dentists seeing chairside that makes them say, okay, we have to replace this? Well, a big systematic review that looks specifically at these complex posterior composites really narrows it down to three main culprits. And we're not talking about small things like a little staining or some minor wear. These are major clinical events. Let's break it down. Number one, secondary caries. So new decay creeping in at the margins. Number two, the filling itself breaks, restoration fracture. And number three, the tooth around the filling breaks, tooth fracture. For years, we've just chalked those fractures up to occlusion. But what if there's something else happening? Let's talk about something called a knit line. If fracture is such a huge reason for failure, could these knit lines be the hidden villain? So what is a knit line? Well, it's basically a microscopic weak point that forms when you're layering composite and two increments of that thick paste don't perfectly merge together. It's like having a tiny crack built right into your filling. This headline from a really important review paper just says it all. So, what are these other factors? Well, first, and this one is massive, it's the patient. Things like their individual caries risk, or if they have habits like grinding their teeth, these can have a way bigger impact on survival than any small difference between two high-quality composite materials. And next, well, it's us. We, the clinicians, play a huge part. It's pretty interesting. Some of these big studies show that restorations done by younger dentists actually seem to last longer. But beyond that, it's our own philosophy. When we decide to repair something versus just replacing the whole thing, or how we're often way more critical of another dentist work, that really affects these longevity numbers. And finally, of course, the tooth's own situation is a massive predictor. Has it had a root canal? How many surfaces are we restoring? Is it a molar that's taking a beating every time the patient chews? A big MOD on an endo-treated molar is playing a completely different ballgame than a simple little occlusal filling on a premolar. Okay, so what's the big takeaway from all of this? How do we take all this data and actually use it to get better results for our patients on a Monday morning? It really boils down to shifting our focus. We need to stop asking, what's the best material for this? And start asking, what's the total risk picture for this specific tooth in this specific patient? And how can you lower that risk? And hey, when we're talking about lowering the risk of fracture, we can attack those knit lines head on. A simple technique is to place a very thin layer of flowable composite of the same shade between each of your layers of paste. It acts like a wetting agent, helping those layers fuse into one solid block. And that kind of leaves us with one last thing to chew on. Maybe our greatest skill isn't just picking the right brand of composite. Maybe it's in mastering the little details of placement, like avoiding those knit lines. Thank you for watching. Check out these QR codes for more information.